hopelessness. Their pessimism stemmed from the false belief that senility, the dementias, was an inevitable result of aging. Dementias were often presumed to be the result of cerebral arteriosclerosis, colloquially known as hardening of the arteries. Researchers didn't recognize preventive measures for that condition until the 1970s. In that era, doctors assumed that Alzheimer's disease was a rare form of senility that began before age 60. The image of the senile man or woman, the traditional stereotype of old age in Western society, was translated into hesitancy on the part of social and scientific policymakers to invest in research into the basic biology of aging. The rationale was that money spent on aging research was money wasted on the decrepit and incompetent. In 1975, the government funded only 12 grants for the study of brain aging, totaling $700,000. But concern was building about Alzheimer's, eventually resulting in the successful mobilization of federal and private philanthropic resources. In 1979, 12 independent groups for Alzheimer's disease existed in the United States and Canada. Dr. Donald Tower, director of what was then known as the National Institute of Neurological and Communicative Disorders and Stroke, and I brought together representatives of those groups and urged them to unite. Their consolidation constituted the beginnings of the present-day Alzheimer's Association. Around the same time, the public began to learn about the disease through the media. Princess Yasmin Aga Khan appeared on 2020 with Hugh Downs and spoke compassionately about her mother, the former movie actress Rita Hayworth, who was afflicted with the disease. Abigail Van Buren of Dear Abby fame also helped develop awareness of the disease through her column. And the National Institute on Aging, in conjunction with the Neurology and Mental Health Institutes, sponsored a symposium led by neurologists Robert Katzman and Robert Terry, along with Catherine Bick of the Neurology Institute that focused on Alzheimer's disease. The book that resulted from the symposium, Alzheimer's Disease, Senile Dementia and Related Disorders, New York Raven Press, 1978, stimulated research in the field. Senator Thomas Eagleton and Congressman Joseph Early supported the initial efforts to make Alzheimer's a national research priority. Today, the federal government, voluntary organizations, and private industry provide support for research, public education, and critical services to people with Alzheimer's and their families. This funding has enabled scientists to make valuable progress in understanding the genetic, molecular, and cellular aspects of the basic biology and neurobiology of aging, and clinical trials are now underway to test potentially useful drugs for Alzheimer's. But until effective treatments are found, we must continue to work on behalf of the growing number of people who deal with the disease. First, we must redesign and expand Medicare to finance long-term care services at home, in the community, and, when necessary, in nursing homes. And we need to ensure proper care at home, where 75% of the care for people with Alzheimer's takes place. An Alzheimer's patient requires constant care and vigilance, often for many years. As learning to speak Alzheimer's makes clear, family members and others intimately involved in caring for patients need support in finding constructive ways to handle the inevitable stress, tension, and frustration of dealing with this extraordinarily challenging disease. Supportive professional advice is essential in the day-to-day struggles of caregivers, who constantly have to overcome their sense of helplessness as they observe the ongoing mental and physical erosion of a loved one. Finding ways to provide such advice is in the best interest of both the government and employers. Caregivers often have to juggle home, child care, and adult caregiving responsibilities with paid employment, necessitating that they take off many hours and days from work to fulfill their obligations.